We're going to pick up with more in just a moment, but first, one of the things that struck me in my research for this report is just how many people in the medical field, people who have access to the very best medical treatments and information, are turning to the DRX9000. With a focus on cutting-edge technology, Dr. Jamie Odom has built a tremendously successful practice in cosmetic dentistry. But over time, severe back pain threatened to jeopardize his career.
A day of doing a couple of root canals or something where I was held in a position for a while, I'd come home and be in pretty bad shape. Pretty much laying on the couch with ice packs and heating pads on the back.
And as his back pain worsened, it started to affect every aspect of his life.
Problems with burning sensation in my leg. Had trouble bending over. Definitely couldn't pick things up. I'm pretty active, like to work out. Had a lot of trouble doing a lot of exercises that involved using lower back muscles.
Using his medical connections, Dr. Odom started reaching out to some of the top orthopedic physicians in the area. But the only option they offered was surgery.
I do believe to take the conservative route, you can always go back and have surgery. Once you start cutting on your body, you can have problems.
Finally, Dr. Odom talked with a colleague who told him about the DRX9000. And within weeks of starting his treatments, his back pain had lessened dramatically. And today, he is completely pain-free.
I will tell you, within probably 2 months after my last treatment, I had no issues with back problems at all. And I still have none today. And it's almost been a year and a half, 2 years.
And with his back pain gone, Dr. Odom is not only back to his practice, but he's back to the active, athletic lifestyle that he enjoys. And every pain-free swing reinforces his belief in the cutting-edge technology of the DRX9000.
I'm always looking for new and better. I'm constantly trying to evolve as a professional, so this made sense to me.
Back now with Dr. Louis Crespo, and Dr. Crespo, a lot of people are going to think because there's pulling involved, there's a lot of similarities with traction, when the DRX9000 spinal decompression and traction could not be more different. Let's talk about the differences.
The differences are, if we look at the anatomy of the spine, you see this gentle curve. With straight traction, you're just pulling on the entire spine. However, using DRX9000 technology, we can actually isolate the disc that's injured. In this instance, this disc here has the jelly coming out. By changing the level of the pull and by eliminating the lumbar lordosis or the curvature, we're able to target this disc and leave the other ones alone. By doing that, we decompress by pulling these two bones apart and allowing the jelly to go back in place. With the decompression, we're getting way over 80% success rate without surgery. I've had several patients that have come to see me at the last minute, already being on the surgical schedule, and I've been able to decompress them, and they've gladly called and canceled their surgery.
Bottom line, people need to get into a doctor's office and find out if they are a candidate for the DRX9000.
Without a doubt, I would not hesitate. If you're suffering from back pain, if you're not doing the normal things that you should normally be doing every single day, come in and get evaluated.
We'll follow up on that in just a moment, but first, one of the things that people who don't suffer from back pain really can't understand is exactly how quickly the pain can come on and how debilitating it can be. Take the case of Janet Milne Campbell, who was active one day and bedridden the next. Janet Milne Campbell prides herself in being full of life and an anchor for her husband and 2 sons. But as her back pain became more and more severe, it became too painful to even get out of bed.
My lower back, the smallest point of the back was sharp, intense pain. Could not move whatsoever. I was so discouraged, like, what can I do? What do I need to do? And it was just heartbreaking for me.
And it was heartbreaking for her entire family.
It was pretty painful. A lot of times I would come home or I'd be already home. I'd see her in the bedroom. She'd just be screaming out in pain.
She was a person that was full of life, and here she's just laying and not being able to do anything, not knowing what the outcome was going to be. Is she going to be like this forever?
Her doctor told her her condition was serious and that steroid injections or surgery were the only options. But this tight-knit family pulled together and search for a better treatment. Then one night, Janet saw a television program on the DRX9000.
Never did I know anything about this before. Never did I ever dream that there was any such thing like this. But the idea, it just was a match for me.
So Janet contacted her local DRX9000 doctor and started the treatments. And a few months later, she is completely pain-free.
I am back to where I was and then some, a whole lot of then some. I am once again mobile. I am once again to do all that I used to do.
Which includes exercising regularly and stretching with a yoga instructor, getting back in the kitchen where she loves to cook and create, and most importantly, sharing activities with her husband and her sons and enjoying them pain-free.
We're back to normal. Life is what it should be. You know, we're be able to go around and do things that we want to do when we want to do it.
This is such a great service and opportunity, the DRX9000 treatment.
One, if you're just joining us, welcome to this special program on the growing epidemic of back pain in this country and a new non-surgical approach to relieving back pain. The technology is called the DRX9000. The science is called spinal decompression. And joining me right now is Dr. Louis Crespo, one of the leading DRX9000 doctors in the country. Dr. Crespo, for those who are just joining us, let's review a little bit about what spinal decompression is all about and talk about the specific protocol for the DRX9000.
Spinal decompression is used when you have a disc that's been injured to pull gently the bones away from the disc, allowing the jelly material that's protruded out to go back to where it belongs. With the DRX9000, through a series of gentle pulls, we are able to pull the bones apart, allowing the disc to regenerate itself and also to get the jelly that has squirted out to go back in place. Usually the protocol is that the patients come into the office after a thorough physical examination. They're placed in the program. The program is a compilation of 20 visits. You're usually there about 45 minutes to an hour for each visit, so it's a definite commitment on the patient's part, but well worth it if you can avoid surgery.
We'll continue in just a moment, but first, as you might imagine, the DRX9000 is catching the attention of athletes around the world who are dealing with extreme back problems. Here's the story of professional golfer Mark McNulty, whose back problems were so severe, they threatened to cut short his career.